John sort of Right, we're just going on to the live stream. Welcome everybody. Slight change of venue today, and just let you all know we've not got the microphones, so it will pick up any noise that's happening in the background. So if there is chatting around, they'll pick it up as well. So just to be aware as we go in, just make sure you keep into script, as to say. So welcome to the meeting today. Firstly, I think I'd like to start off by just taking a moment to acknowledge what some of us have just been in before, which was the Day of Reflection for the commemoration event for COVID. It was hosted by Nottinghamshire County Council, and 5 years on, it's quite interesting to see members and civic representatives come together to reflect on what COVID did to us as a community. The pandemic had a profound effect on all our communities and impacted all of us, but it also revealed significant innovation, strength, resilience and compassion. Volunteers, health and care services, county, district and borough councils, police, fire services, voluntary, community organisations and many others worked tirelessly to protect and support residents, some of them going through some of the most difficult times in recent history. And this dedication protected people, provided comfort and helped our communities. We know that the impact of COVID-19 was not felt equally. The pandemic exposed and deepened health inequalities, hitting our most vulnerable hardest. As we reflect, we recommit ourselves to addressing these disparities, ensuring that every person in Nottinghamshire has the opportunity to thrive and live a healthier life, recognising that the work going ahead remains crucial. So thank you to all of those who were able to join us today at the event and for your ongoing support through the partnership. So thank you everyone who was there. So as we go on to the actual meeting. So can the board agree the minutes are an accurate record of the last meeting held on December the 18th? Everybody happy? Yeah, thank you ever so much. So I'll hand over to James now for apologies for absence.
Thank you, Chairman. So we've had apologies from Dr. Dylan Bartholomew, Sarah Collis, Lee Edel, Councillor Penny Garland, who's been substituted by Councillor L. Henry, Councillor Angie Jackson, who's with Councillor Caroline Ellis in attendance, and Melanie Williams, substituted by Katie Ball. Thank you, Jim.
Thank you ever so much. Item number 3, does any councillor or officer have any interest in any matter on the agenda that they need to disclose?
Just a matter of transparency. My daughter works for the NHS. So
thank you ever so much.
Just to make sure.
No, any others? No, fab. Thank you very much. So item number 4 is Nottinghamshire Health and Wellbeing Board Review Update. So first on the agenda, we have the report from the review that was happening at the moment. The purpose of this report is to provide Health and Wellbeing Board members with an update on the progress of the review since the last update to board in November, and to request members support the actions proposed to address the feedback from the workshop we had in February. So before I hand over to Lizzie to introduce the item, can I have someone second the recommendations, please? Lizzie, you have a second. Thank you ever so much. Right then, I'll hand over to Lizzie who will introduce this. Thank you.
Thank you, Chair. And so Lizzie Wintz-Wilson, Public Health and Commissioning Manager at Nottinghamshire County Council. As the Chair has highlighted, I'll provide a brief overview of the Health and Wellbeing Board review paper. So just to recap, the Local Government Association has been supporting the Nottinghamshire Health and Wellbeing Board in reviewing its function as part of an established offer to help health and wellbeing boards refine their purpose and strengthen their role within the health and care system. You'll already be familiar with the background of the review as outlined in the report, and I'd like to thank board members for their continued support with this work and recent participation in the LGA facilitated workshop on the 5th of February. Today's report highlights progress since the last update brought to board on the 13th of November, as Councillor already has said, and outlines a number of proposed actions and associated recommendations that I'd be keen to highlight to board members today. The first is endorsement of the draft Nottinghamshire Health and Wellbeing Board Compact. So the compact is a key output of the 5th of February workshop, where board members discussed and set out operating principles that they felt like would support the board to achieve what good looks like and would set out their role in supporting those principles. The document is intended to guide future ways of working, and a draft is brought in front of the board today for comment and support. The second is support for reducing the frequency of formal board meetings. The report recommends aligning frequency with neighbouring health and wellbeing boards, which largely meet on a quarterly basis. Feedback through the review suggests this would be a more effective and proportionate use of time for both members and supporting officers, particularly if sufficient space were to be held after each formal meeting for informal workshop discussions, acknowledging that formal meetings perhaps will not always be the most effective format to progress action. And the final recommendation that I just like to draw attention to is refocusing the board's oversight of the JSNA. So the report recommends delegating approval of JSNA chapters and profile packs to the Joint Health and Wellbeing Steering Group, while the board retains its strategic oversight through approval of the JSNA work programme. This shift is intended to maximise the impact of the board's role by moving away from sign-off of individual profile packs and chapters, which could tend to encourage a scrutiny type discussion. Instead, it will allow board members to retain oversight by setting the overall work programme, and members will continue to be able to engage in action-focused discussion of individual JSNAs through webinars, which are open to a wider range of local stakeholders and professionals as well. These actions and recommendations address some key themes highlighted through the review, including maximising people's time and expertise, strengthening the board's strategic partnership role and focusing its priorities. As outlined in the next step section of the report, the intention is to pick up discussions to identify one or two priority areas for the board to give focused attention to once there is greater clarity on the evolving landscape that partners are operating within, recognising work that's going on currently around local government reorganisation and the anticipated release of the NHS 10-year plan. That's all I was going to cover on the report today, so we welcome any questions or reflections.
Okay, thank you ever so much. I'll open it up. Has anyone got any comments, questions? Councillor Wilmot.
Yeah, so the first, of course, it is to say that you're going to cut down the meetings. I hope you're not going to cut it down to the barest minimum, because there are issues in the NHS that need regular discussions and regular thoughts of all the members, to make sure that we are scrutinising the issues that need to be developed and so forth. So I just hope that we don't go down to the minimum possible. I think we 6 or 7 at least should still continue on that issue. The next issue, of course, is the 1 to 2 priority areas. I don't remember anybody saying just 1 to 2. I remember me talking about half a dozen, because if you just get down to 1 or 2, you're going to miss out on many of the real big issues. So we should be looking at half a dozen. I know very often it comes forward as 20 or 30, which is ridiculous. You just can't debate all that amount all in one go. And on the clarity of role and responsibilities, we need to get together to make sure that when any issue is discussed, that the group that is actually leading on that issue should be at the meeting. So they may not be even part of our group at the moment, but it is essential when something is talked about that there is some information from somebody that knows what they're talking about, if you understand what I mean. And it does reduces the duplication then on that issue. And reviewing membership, as I've said, we need to get more organisations in the membership, but many of them we won't expect them to be at every meeting, only at meetings where the discussion is about their part of the national health. So that's pretty well, what I've got to say. But it is essential that we don't put all the workload back so far that it's pointless meeting on a regular basis.
No, thank you for that. I think one of the points you made about is about scrutinising. This is meant to be a strategic partnership, so it's not about scrutinising. And I think the meeting frequency was about people travelling and making it more worthwhile when they're here. And I think that's one of the really important parts that we were looking at. And it was mentioned across the board during the review that people did feel that if they're coming here, they'd rather have a longer meeting rather than come here every other month. So that was one of the things that they said. But no, I'll hand over to Viv if you want to come back on some of that.
Yeah, and thank you, Councillor Wilmot. So some really interesting points there, and I think there is something that comes back to me in terms of if we go to the draft compact within the papers that you've got, which is on page 19. I think some of the points that you raised there, I think are really worth unpicking. So I think just as Chair has highlighted, I think there is something around being really clear around our role here.
Yeah.
And our role is around how do we add value collectively above and beyond what our organisations are doing to really drive change to improve the health and well-being of our people in Nottinghamshire. And so there's something for me around one, making sure that we're not slipping into that scrutiny phase, because we've got some very effective other processes to ensure that we do that. And I think there is something around if we feel that there are emerging issues that aren't being reflected in our scrutiny and our select committee, then how can we have that conversation with the chairs of those to have a conversation around work plans for those, so that we do make sure that we're focusing our areas on that partnership space, and how do we produce that additionality above and beyond. And I think for me, that's where I think a sharper focus on a number of things will add more value, because I think there's something around how do we coalesce around a particular really complex issue that we know is going to drive change for our population. So something for me around that. In terms of the membership, I think there is something to consider in terms of have we got all of the partners around the table today. I think we have gaps in terms of police and fire, for example, that we might want to consider, and there might be other partners around the table that I think would have a regular contribution to those. But I think there is also something around the balance between the formal meetings and the workshops, because if we have a workshop around a particular topic, we can open the doors much more broadly to have a much more richer conversation with those topic experts, and that we are making sure that we're informing ourselves really effectively there. And I think there will be some more work to do around subgroups as well, and we'll have some discussions around the Joint Health and Wellbeing Strategy Steering Group as part of this, in terms of some of that delegation of the Joint Strategic Need Assessment work as well. So those were my thoughts, but really keen to hear what others think.
Yes, Professor King.
Do you want to go first?
Councillor Tynesford, do you want to go?
Right, yeah, I concur with what Councillor Wilmot just said. As we speak at the moment, just for example, we know that bad decisions were made in 2016 when they decimated what was then Shore Start or whatever it is. And now I'm pleased to say, as we're speaking, they are actually having an open day this afternoon. Unfortunately, I can't be there because I'm here. I'll be in two places, I suppose. They are absolutely an ideal organisation. They'll say in 2016, unfortunately, they decimated it. That was the biggest mistake that County Council made. And hopefully they won't make that again. But they are making minor, and this is a minor mistake they've made. They've actually dictated to them what the place is going to be called. It's now being called Chilwell Hub. The only thing is, just below them, there's a day centre, and that's called Chilwell Hub. So there are those minor mistakes that are being made. I think we have the right to scrutinise the decisions that have been taken. And hopefully, in a wider view, we know that now there's going to be a better partnership. We need to be oversight on that partnership and make sure mistakes are not made.
No, totally agree. But Colin, do you want to come in?
Just a point of comment accuracy. Nottinghamshire County Council has been spending more than £10 million a year on family centres, which was the successor of the Sure Start Children's Centres. There isn't a single local authority in the country that spends more per capita on family centres and family hubs at Nottinghamshire County Council.
No, thank you. Professor King, did you want to come in?
Yeah, just I think, no, this is a really good set of recommendations. I think it reflects well the conversations. Two key points. First one, I think, is that piece, and I think, Viv, as you responded to Councillor Wilmot's point, was really good about saying, you know, what the purpose of the board is. And I agree that I do not see this as scrutiny. I think it is that partnership. I think within this document, it'd be really good to have very clear articulation of what this board exists for, what its levers are, what its possibilities are for action. So I think then we can begin to cover looking on that stuff. I think that helps clarify how many thematic priorities we are able to undertake as a board strategically, because that is about bringing different actors together to bring about change and improve the health of our population. Then understanding what that is and understanding our role and therefore what we do. So I think a clear articulation of that purpose piece. I just think that statement would really help. That there may be people on this board have different interpretations of what that might be, and that might be something we need to flesh out. Without that clarity, I think then we won't progress. So that might be a bit of uncomfortable conversation, but it feels to me something that's essential. As a more minor point, I think coming out certainly on the table I was on in that conversation was around sort of the induction and the understanding of people when they join the board, or maybe also if we're transitioning and we've got a clearer purpose, there is that transitioning process as well. That didn't seem to be reflected within this, and that felt quite important to me in terms of distinguishing from maybe other meetings that people are in around what the purpose of this is as well. So I would really suggest we build that into this, not so much about induction, but about building that common shared understanding. Induction seems one of those aspects, but there may be others as well. But to my mind, these things only work if we've got a clear sense of purpose, and through that, then what are the levers that this board can act on? If we don't understand those, then we won't do the most useful conversations in the time that we've got, and everything else flows out of that.
No, totally agree. And coming up to May in the elections, county councillors on this are going to change as well. And I'm not re-standing, so there'll be a different chair in place as well. So we'll end up having to have an induction process for them. So I think it is something that we need to add in and think about. So definitely. Viv, did you want to add anything?
I think you make some really good points there about, we did have quite a lot of discussion around how do we make sure that when people are new into the board, they're also brought on the journey that we've all been on. And I think that's going to be really important moving forward. We have got the opportunity in May when we come back to full council to describe what the Health and Wellbeing Board is, to make some of those changes. But I think what it might be worth doing is making some of those amendments and making sure that board members are happy with that, so that we're ready in preparation for May, if we can, Chair.
No, that would be really helpful.
Can I just come back one final point? Maybe, is obviously there is a role and a need for scrutiny. I guess the question is mapping what this board does vis-a-vis other sort of democratic places as well. Might be useful to see, say like the example of Short Start. Is it appropriate that is here, or is it somewhere else that scrutiny takes place? So maybe just seeing it within the round. At the moment, this is a document about this board. It doesn't see it in the context of wider sets of activities that are going on. That might help sharpen the focus of what we can do vis-a-vis other groups and where the best energy is.
And how district councils feed into the scrutiny of county probably is what we need to look at as well, isn't it?
That's what I'm saying.
Councillor Sheila.
There is a health scrutiny committee in county council, and therefore I think there's something here about how the two speak with each other and communicate across and acknowledge that the scrutiny is actually taking place and of the strategic aims that we seek to deliver.
No, I think that's something to think about, actually having a bit of a feedback from health scrutiny and vice versa.
And whether the Health and Wellbeing Board have a regular, almost are scrutinised by the Health Scrutiny Committee on a regular occurrence. it may be an annual scrutiny that they attend.
I just feel that with this brings on the thing about partnership working, because I've been sat here for like nearly a year, and I will admit that when Angie and I first came here, we were like deer in headlights because we didn't really know what you were doing and what the purpose of. So as we say, as we come to May, and then are going to be changes, that people that come into post are aware of what the principles are and who we are working with, like you're sort of saying. I think we're missing out, and this is part of the document, that we're duplicating, or we're not duplicating things bigger, because we're not actually speaking with partners who've got similar interests, whether it be Sure Start, family hubs, or whatever, is how we can maximise the most out of all the groups that we've got for the residents of Nottinghamshire.
But continue to have that governance process.
Yes.
And the governance will come from the health scrutiny committee.
No, it's something we can take away, definitely. Any other comments, questions? So is everyone happy with the recommendations outlined in the paper? If we have a look at getting a statement put together as well that we'll send round and circulate after the meeting, is that all right? So is everybody happy with the recommendations outlined in the pack with the addition of the statement? Yeah? Yeah. Fabulous. Right then, can we just vote on the recommendations? Can I just have a show of hands just so that we can put that in? Fabulous. Thank you ever so much. Right then. So, next on the agenda, we have the 25-26 Integrated Care Strategy and the NHS Forward Plan Annual Review. This item will serve as a progress update regarding delivery of the Nottingham and Nottinghamshire Integrated Care Strategy, and will seek support for the approach to reviewing the progression strategy and the Nottingham and Nottinghamshire Joint Forward Plan. I don't know if I'm handing over to you, Victoria, or Joanna.
I'm going to hand over to Joanna, if that's okay. Obviously, colleagues will be aware that this is something that we are doing on an annual basis now. In terms of the integrated care strategy, I want to emphasise that we are and have agreed to do a very light touch refresh because we are all very acutely aware of the fact that we have got a local government reform agenda. We are anticipating the publication of the 10-year NHS plan, probably May, June time, and we know that that could be fairly significant in terms of asking us to look at different priorities. So please take this in the spirit of it as a light touch refresh of existing commitments.
Perfect. So before I hand over to Joanna, can I just have someone second the recommendations on page 26 and 27 of the pack, please? Yeah, thank you ever so much. Right then, Joanne, I'll hand over to you.
Thank you, Claire. So hi everybody, I'm Joanna Cooper. I'm Assistant Director of Strategy at the Integrated Care Board. Hopefully you can hear me. I'm not a very loud person and I've got hay fever. Hooray. I'm going to try and I'm going to take the paper as read and I'm going to try and make it as easy as possible to understand. So we've got two sets of slides. I'm going to talk about the strategy first, and then if that's okay with the chair, have a little breakthrough discussion, and then we'll move on to the joint forward plan. Just go to the next slide, please. So this hopefully is something that's familiar to everybody. This is our collective vision for Nottingham and Nottinghamshire, agreed through our integrated care partnership. So that's the partnership between the city and the county council and the integrated care board, and the health and wellbeing boards are really key to playing into that. So we've agreed that vision. We've got 4 high-level strategic aims for our population, and we've got those principles of prevention, equity, integration, which I hope you all remember, because that's normally the thing that I say about 20 times whenever I come to see you. So that's our strategy, it really is. Next slide, please. So as Victoria said, light touch review. We planned that for March annually, and the Integrated Care Partnership meets twice a year so that it can fulfil that function. They last met in October and they confirmed the 2025 refresh will be consistent in terms of that vision, those outcomes, those ambitions. But we would look to refocus and narrow down the number of priorities that we were looking at. We'd be looking at our partners assembly that meets twice a year as well, and how we best use that time. So there's an update on that in these slides in the paper also. The ICP next meet at the end of this month, fast approaching, 24th of March, and colleagues and board members around the table and across Nottingham and Nottinghamshire have been asked to be part of that process since October. We've been gathering feedback, having conversations with system partners, and there's actually about 53 responses now that we've had back in formally from those groups and organisations. Next slide, please. The Partners Assembly met on the 3rd of February. That was specifically held to talk about the strategy and also to talk about the upcoming 10-year health plan. The event was attended by over 150 people, and there were some key messages coming out of that for everybody. So strong support for the system goals, especially prevention and community, but many people wanted to focus on outcomes and action over something that might feel a bit theoretical or not tangible. Delegates highlighted how important it is for us to be more aligned, tackle issues and possibilities, opportunities together, strengthen our regional partnerships as well. So we've got, since our last version of the strategy, MCA has formed Nottinghamshire and Derbyshire closer together. So there's lots of opportunity in that. There's also digital transformation was highlighted as a priority in the discussions, but with some concerns around that, which our digital colleagues are taking forward. And lots of people agree that our services should be shifted from hospitals to community settings, and having that stronger focus on our voluntary community sector partners, and ensuring that we're empowering people to manage their own health and wellbeing in the community. We do have a separate report that's available on that. If anybody would like to be sent that, I can arrange for that to happen. Next slide, please, Lizzie. So our refresh of the strategy, it's a pithy document. It's been described as, it's a little bit shorter than the original, but it covers the things that you can see on this slide. So some of the priorities in that, just to try and bring it to life a little bit more, we're looking at narrowing down our focus on 3 key areas which hopefully resonate with health and wellbeing board members. So best start, a focus on frail and older people, and a focus on health and work. So 3 things that partners have consistently fed back that they're supportive of as priorities for local people across Nottingham and Nottinghamshire. The strategy also goes into some detail on our transformation approach, and that's centred around 3 key things. So one is that neighbourhood working. So there's been policy out in the last couple of months around how we need to increase our focus on neighbourhoods. And in our strategy, we've written about how we will focus on accelerating our integrated approach with integrated neighbourhood teams. We talked about promoting greater collaboration at place and at system level. So that's our provider organisations working closer together, really embodying that integration principle within the strategy. And then lastly, accelerating our collaborative commissioning approaches and creating the conditions for success. So our commissioning organisations also working in line with that integration principle and looking at the opportunities and things that we can do jointly together for people that live here. We're also bringing out the prevention, equity, integration again, as you'd imagine. They're a really integral part of the strategy. And we've got some prevention priorities listed in there, and that's the things like the health and work, best start, alcohol misuse, exercise, a focus on vaccinations and immunisations, long-term condition management, and severe multiple deprivation. There's quite a lot packed into a punchy document. And that's all I was going to say on the strategy part of the paper. So to you, Chair. Thank you.
Hey, thank you ever so much. Any comments or questions? Councillor Wilmot.
Yeah, we talk a lot about reviewing the Nottinghamshire Integrated Care Strategy. I mean, I'm looking at the whole paper, and on page 22, on C, it's telling you how many people you've supported in different aspects of the smoking, weight loss, physical activity, and so forth. But when you think there's 850,000 people in Nottinghamshire, that was the last figure I was given. It's so minimal that you know it makes one prime objective that I've talked about for so long: the principles of prevention. Prevention is far better than having to actually reduce the alcohol consumption and this, that, and the other. But we've got down. I mean, you only looked at paper yesterday. The rising of obesity is now got to over 50% of the population, and within 5 years they're estimating that 80%, up to 80% of people will be obese. That's the sort of issues you've got to tackle. You know, rather than waiting for people to come in that's got problems due to obesity, due to smoking, due to drug misuse, alcohol misuse. All of these issues have to be tackled before they actually get to a serious position. And, you know, it's absolutely essential. And as I say, in C, on page 24, you say treatment to prevention, focusing on preventing sickness, not just treating it. That absolutely should be our top priority. And, you know, I hope that you realise that. Thank you.
Thank you for that. I don't think there's anyone around the table that won't say prevention isn't very, very important. Joanna, do you want to come back on that?
I think I agree as well. Prevention, the principle of prevention is embedded throughout our strategy. We've done a lot of work over the last 12 months, working with partners across the system to try and understand how we can embed those three principles in everything that we do.
Thank you. Victoria?
Just, I don't think there would be one person, including our Director of Public Health, who wouldn't absolutely applaud the comments that you've made. And again, given the fact that we are the Health and Wellbeing Board and we are partners who have really good in-reach into our communities and are very influential in many ways, and have the opportunity to really potentially come together to shift the dial on some of the progress that we've made. It could be that when we think about those key things that we do want to focus on, how might they bolster and support the things that we've already agreed as our strategic priorities and add even more value? It's kind of, for me, would be really good, wouldn't it, to think about those things that we want for our work moving forward. Obesity, eating well, moving more, those are the things that actually, I think we've got a real opportunity with our partnership coming together to really add value. So I applaud the statement that you've made. And for me, let's convert that into some action then. What can we do collectively to really increase those numbers and have a bigger impact for our community?
If I could come back just for 1 second, Chair, and that's why it's essential we get the right people onto this board, not just the ones that you know we've got at the present time, but the outreaching groups that you know are really doing good work we don't know anything about. So if you get knowledge of what everybody's doing, you know, it gives us the opportunity to discuss it and see how far we can go with helping that organisation.
No, totally agree. Thanks, Steph.
So building on comments of other partners, I'm fully supportive of what the comments that have both been mentioned there. And I think there is something for me around how do we ensure that we take the ambition and drive that we're expressing here and genuinely make sure we move into action. So one of the points I was going to raise, which Victoria is very articulately mentioned, is around we've got some key priorities here, but how do we then think around how we as a health and wellbeing board are going to drive this in support of delivery of the integrated care strategy? So that's one of the things that I'd be keen to think around, and we've talked about what priorities we want to prioritise, and we've got some areas to consider there. So there's something for me around that. In terms of Councillor Wilmot's comments around our rising rates of obesity, and also we know that smoking is one of our highest causes of premature mortality. I think you're absolutely right. There's something around how do we increase the pace and the scale around the work that we're doing around prevention. And I acknowledge that's really difficult in the situation that we have, where we have many burning platforms that are happening today. And how do we make sure we do work today to make sure that those burning platforms don't get 3, 4, 5 times worse? But we do need to concentrate and put some resource into prevention, because if not, they will. We can already predict that demand is going to happen. But one of the things that I'd really want to make sure that we are always thinking of, and it leads on to the next agenda item, which Carol and colleagues will be bringing us into, is around many of the factors that link into our lifestyle behaviours are around those building blocks around us. So we know, and then we'll have some conversations around that in a second, around some of those things. So good work, good housing, environment we live in, the social connections we have, they increase or decrease our risk around some of these other lifestyle factors. So what I'd be really keen to make sure that we don't do is just focus on the services that we're delivering, because we actually know that in terms of your overall health and well-being, access to healthcare services only actually contributes to about 10 to 20% of your overall health and well-being. And it's those broader factors that are around us, the way that we are born, live, work and grow, that actually we can have influence on as a board collectively, and we can shift the dial in a more effective way. So really supportive around thinking around what can we do in prevention in terms of increasing that pace and scale. But let's not forget our lens around prevention, because actually I think one of the things that came out of a lot of the discussions that we had at the workshop was around this board is in a unique position that we can look at those broader factors, and might be, some of us call them wider determinants, some of us call them building blocks. But I think that's something that we should really be focusing on and should consider as part of our priority work areas.
Thank you. Councillor Henry.
Yeah, thanks, Chair. I agree with some of the things you said, John. It's really good, and you've been pretty happy with listening to some of those responses. But the little bit I wanted to just ask a question about, two points actually, on page 24, paragraph 15A, the discussion around the recommendation from the design report about moving care from hospitals into community. What I want to know now is, do you expect this to bring changes to how responsibilities are allocated within the integrated strategy? And will this mean that councils will have a greater role in care? And if so, do you expect any extra funding to actually account for this? That's going to be it. Yeah, I can go to the next one if you want first. Yeah, and the other bit that I want to ask is the one on same page 24, but it's in paragraph 20. We're in discussion around the NHS transformation. So is there alignment or coordination between the strategy partners on transformation, especially around the projects and stuff that we're doing? Or if not, would this be useful? If you've done that, what are the key areas of transformation that has been agreed by the partners? That's all.
I'll try.
Yeah. Okay.
Yeah. So we are all in a very, very financially challenged context at the moment. There is no expectation that we are going to have any extra new resources coming into our system. Absolutely not. We have a significant financial challenge from an NHS family and community point of view that we are going to have to resolve in the next financial year, of a significant quantity of money. So our focus is on making sure that we can continue to provide the best possible care for people, but we use every single penny to do that in the most cost effective and efficient way. So what we are doing is looking at every opportunity to drive value for money, to drive cost efficiencies and cost effectiveness in the way that we spend what we've currently got, rather than looking for new and additional money from anywhere else. So hopefully that allays that concern. But we also know that by working together, we've got better opportunity to maximise the pound that we do spend. So what we do have is, I think it's 11 transformational priorities now that we've agreed with partners from the NHS and local authority engagement, actually. We've had some really fantastic engagement from the County Council in the Frailty Programme, for example. And those 11 priorities are really clearly of areas of opportunity that we know from benchmarking data from looking at how we perform and from the feedback that we've had from patients and members of the public, that there are opportunities to do things better. So we've established these 11 programmes of work, and we are being very focused about what can we do better for people, but within the same, if not less, money. And so, yes, we do feel that we've got really good alignment with those.
Thank you. And Katie.
Thank you. I think I was going to say a lot of similar things to what many people have said, and just really agree with that prevention focus. I think the language of neighbourhood health is really helpful, and that collective focusing on that opportunity is really helpful. So we've been focusing on prevention for a long time, but it feels like some of the national policy and legislation aligning even more, and our local structures aligning even more, gives us some slightly different opportunities. And so I was just supporting that notion of how we think about our individual organisational contributions and leveraging our partnerships, but also how as a health and wellbeing board we make those connections at those different levels, anchor through to our neighbourhood health communities, teams, voluntary sector partners, and make it easier to build even stronger connections, make the resource that we have got easier to connect together. And that then flows and helps the integration, equity priorities within the strategy as well, alongside things like digital. So I think probably the only other thing to add is our role in thinking about some of the test and learn in some of that, because what we do know, well, we certainly know in the children's world and much of the health landscape, there's a lot of evidence of good practice, but actually there's still quite a lot in the social space where we haven't got as much evidence nationally as we'd like, and doing some of that test and learn will be really important to support and keep hardwiring the funding to the right things.
Yeah, thank you. Councillor Crosby.
Yeah, we just got a couple of questions from IT, myself. We just have a question on the joint health and wellbeing strategy and what the timeline is on this. We try where possible to align our health and wellbeing strategy, which is up for refresh next year. Will there be a new strategy in light of the government's reform, or will there be a focus on bringing these together?
So thank you for that question. So in response to that, the joint health and wellbeing strategy at the moment, correct me if I'm wrong, it was till 2026, isn't it? So we will need to start thinking around where do we want to go with that. I am really conscious though that there's lots of things moving around us at the moment. So whether that's the NHS 10-year plan, whether that's the devolution white paper. And so I think and this comes back to some of the priorities conversations where we're saying let's let some of that settle a little bit before we think around where we want to get, from a county council point of view as well. We've got elections in there. So we need to be thinking around what does that mean? Because I'm really keen to think to have strategies that add value. The Joint Health and Wellbeing Strategy is a statutory component of the Health and Wellbeing Board. So we will need to think about what that means. But I think once we're aware of what the landscape is settling like, we can think around how do we want to play that. And I think that's discussion for the board to decide, because I'm really keen that it's something that we develop collectively. And we might need to think about some of the feedback that we've had from our LGA colleagues in terms of really being clear around the priorities. Because some of the feedback that we've had at the moment is that there are so many priorities that we're really losing some of that. So yes, it's on the work plan, but let's let the dust settle a little bit if we may, and then we can start thinking about that process in terms of how we think about what we might want that to look like in the future.
Thank you very much for that.
Councillor.
Yeah, if I could just go on one more quick issue. The hospital to community will be more care for hospitals to communities and in primary care. We'll promise some time ago that there may be 40 new hospitals, but we know that the financial position could not bear that. That is one of the reasons why myself have been campaigning but such as smaller areas to get a camel centre like the one I put forward for Hucknall, so to take some of the burden off the major hospitals, so that, you know, gives them the opportunity to be able to do a better job than they are doing at the present time because they're overstretched. And if they had smaller camel centres in towns, you know, not too many, because we won't be able to afford that either. But it's essential that, you know, we've got a straightforward answer from whoever's in charge. You know, how are we going to process the position that we're in at the moment? Because the hospitals cannot continue like they are at this present time. It's absolutely incredible that they're managing to continue just with the restraints that they've got at the present time. And as I say, it's essential that we start looking for little camel centres that can do small operations, as well as have doctor surgeries in there, and specialists who can be in there, because we're trying to put people out of the hospitals into the homes, and that camel centre would be a nice area where they can go to with problems, the ongoing problems that they have, or have visits from people, so that they can get the necessary position where they live a sensible and lovely life.
I know you've been an advocate for the Hucknall Centre for a long time, but I know we've had an answer about that before. Are there any other comments or questions before we move on to the forward plan? No? Joanna, shall I back to you then?
Thank you. I have the next set of slides, so just going to shift focus slightly. So now we're very much talking about NHS family, not the whole integrated care system. And on the second slide, there's some bubbles which try to show you those connections between, and this is one of the pages from our draft joint forward plan. So we have our integrated care system and our integrated care strategy, that the integrated care partnership. Apologies, these are all national acronyms. That vision that we've just been talking about. For NHS partners, we also are required to do annual operational planning, which we get a big long list of priorities, which is slightly shorter this year. And we also have to do a joint forward plan, which is the document that we're going to talk about today here. And the joint forward plan is has similar policy and guidance from NHS England, but it's got a 5-year forward look. It's not just the coming year, it does expand that look. And it's our delivery plan for NHS partners of how we'll deliver against our annual operational priorities, any other priorities from NHS England, and our integrated care strategy. So it's got quite a big job, and we try to make it as short as we can. It's still about 50 pages long, so apologies for that, because you had a draft of that in your inbox. Could I get the next slide, please? So this is another annual refresh of our joint forward plan. We've aligned the timescales with the strategy so that both documents can be considered at the same time. NHS England did publish some guidance for us, but on the 30th of January, so it was quite late in the day, but that aligned with their timeline for publishing all of the planning guidance. And our Integrated Care Board met in January and agreed a similar approach for this. Just given that shift in context, we would have a light touch refresh of our joint forward plan and revisit that once we had a bit more clarity on the national policy direction. Partners have been discussing and having drafts of joint forward plan, and we've had about 31 different responses from system groups and organisations where we've logged that feedback and taken that on board in the refresh. For this document, we're aiming for the Integrated Care Board meeting that's on the 13th of March, so that the document can be endorsed and published and fully in public domain. And could I get the next slide, please? Thank you. So there's the document itself covers some of our big ticket items for our local NHS partners. Victoria said we've got quite a challenging financial position for our NHS partners. We're looking at embedding the integrated care strategy principles. The prevention equity integration is again read through this document, as well as those 3 national shifts that we've just been talking about, that treatment to prevention, hospital to community, and the analogue to digital. We've tried to future-proof the document as much as we can, given that we know we will be revisiting this over the next few months. If I could have the next slide, thank you. So, Councillor Henry, you mentioned our transformation programme. So we've got those 11 on the side. Those are things that we've collectively agreed, not just as NHS partners. So we have a transformation delivery group that does have local authority officers as part of that group, and they've been part of helping and supporting to shape what those transformation priorities and the focus should be. So very much aligned approach. And we've pulled out some of our prevention, equity, integration actions where we feel that we will be working together jointly on those and how we'll be embedding them across our health and care system. And the last slide, just in this pack, echoes, that's not come out very well for you. Hopefully we can share these for you. It highlights our three transformational changes that I talked about in relation to the strategy. So again, that focus on neighbourhoods, that focus on providers working together jointly, and that focus on commissioners working together across Nottingham and Nottinghamshire and beyond. So very much alignment between the two documents. Health and Wellbeing Board do have a role in formally endorsing joint forward plan and how it delivers against the joint health and wellbeing strategy. And there's a statement for you in the report in paragraph 22 that I'd be really welcome of your support for. Thank you, Chair. That was everything from me.
Thank you. Any comments or questions? Yeah, everyone happy? Everyone happy with the recommendations? Any comments? No? Right then, shall we have a show of hands for the recommendations outlined in the report then, please? Thank you ever so much. Thank you. Right then, so next on the agenda we have the Joint Health and Wellbeing Strategy 24-25 Quarter 3 Delivery Report for Ambition 2 of the strategy, which is create healthy and sustainable places. Lizzie Wins-Wilson will introduce this item and hand over to Carol Ford and partners for the collaboratively developed deep dive into Ambition 2. The primary focus of the discussion today will be on the Ambition 2 presentation and the opportunities for action for Health and Wellbeing Board members highlighted in the broader report. So before I hand over to Lizzie, can I have someone formally move the recommendations, please, on this? Thanks, Sinead. Right then, I'll hand over to you then, Lizzie. Thank you.
Thank you, Chair. I'm just going to keep it very brief before handing over to Carol to kick off the Ambition 2 deep dive. Taking the report and the Quarter 3 highlight report as read. Board received sort of first iteration of this style of reporting back in the December meeting. There's just one new escalation outline within the highlight report that I just want to pull out, specifically relating to the action to work through Health and Wellbeing Board member organisations to sign up to the Prevention Concordat for Better Health. So a recommendation was made at the Health and Wellbeing Board in December for board members to consider organisational sign up to the Prevention Concordat where it's not already in place, and to review any existing mental health action plans in light of the publication of the adult mental health profile pack that was shared with board last time. Just because we had slightly reduced attendance at the December board meeting, this has just been this opportunity that's being raised for awareness, and it's also being promoted through the Integrated Care System Mental Health Partnership Board. But I'll hand over to Carol now to take us through the Ambition 2 deep dive.
So hi everybody, I'm Carol Ford from Public Health of the County. So I'll be talking us through the slides that have been shared with the board papers on Ambition 2, which gives a broad overview of the work across the partnership to deliver on the Health Sustainable Places ambition. And it also provides a lot of further links for a lot more detail. So the things that I'm going to focus on as we talk through the presentation are, I'm going to highlight just a few of the key achievements that are in the slides. We're going to have a spotlight on spatial planning and health. So this is one of our key systematic opportunities to drive action on building blocks through the planning processes. We've got a number of partners here as well that are going to join us to talk through some case studies. So we really want to show, demonstrate the breadth and the impact of the work across the different place-based partnerships. We're going to note some of the challenges that have come to light as we put this together, and then we'll look at some key areas for action over the next 12 months. Next slide, please, Lizzie. Thank you. You might recall when we brought the an update on Ambition 2 last year, so last March, we talked and we introduced this idea around the building blocks of health communications approach, which we've been trying to embed in the delivery of this ambition and more broadly. We also followed it up with a workshop with the board last April. Just wanted to thank board members really for their engagement in that event. We were able to, with the feedback that we got on that day, we were able to inform the development of that programme. But it also allowed us to connect the programme into some wider partnerships across the county, so it's helped us have a bit of a broader read. But just as a reminder, this is an evidence-based communications approach to increasing understanding of and inspiring action on wide determinants of health and health inequalities. So this is just a reminder of the metaphor, which is one of the 5 recommendations of the approach, that to create a society where everyone thrives, we need all of the right building blocks in place. Jobs, good pay, quality housing, education, etc. But right now, in too many of our communities, these blocks are missing, and it's time to fix the gaps. And I'm hopeful that you'll see throughout the presentation the way that we articulate the ambition. We're using this to frame our work, our communications, but also how we're acting on each of those blocks. Have the next slide, please, Lizzie. Okay, so I'm aware this is a really busy slide, so apologies. So we've got 2 slides to start with around the key achievements over the last 12 months. Of course, it's a really broad ambition. It's delivered across lots of partnerships, lots of different organisations, some at community level, some county-wide and corporate, so it's a real mix. We can't capture everything in this update, but I'm really hoping this gives a sense of the breadth and the impact of the work. So I'll just highlight a couple of things on this slide, a couple of things in the next slides before I hand over to colleagues. So on this slide, there's examples where we're informing strategic planning on some of those key building blocks. So you'll see we've published our fuel poverty JSNA, work and health JSNA that came through this board over the last 12 months that's starting to inform the next steps on those really important agendas. There's some key policy developments that we've highlighted here. So there's the publication of the County Council's housing strategy and the net zero framework. There's some good examples here of where we're strengthening partnership approaches to some really important areas. For example, the Air Quality Oversight Group and the development of that over the last 12 months. There's some examples of direct support to residents here. So there's some examples here from the work of the Nottingham Energy Partnership, which deliver the Healthy Housing Service, which provides advice and guidance to residents that are struggling to heat their homes. And some examples here where we're trying to increase understanding of these important issues. So for example, the rollout of carbon literacy training. There's a lot more in there. Can I just have the next slide, please, Lizzie? So again, some more achievements here, and you'll see these are kind of directly relating to each of the building blocks. So just a couple to note in here. There's some examples here of where we're supporting local community projects. So we've got the second round of the food redistribution grant last year, which is funding going directly to local projects for addressing food insecurity. That's the second round of 3, so there's a third round this year coming. Some examples where our work is strengthening relationships between local partners, building community capacity, and that's through the Investment in Communities through Place-Based Partnership Programme, and we'll hear a little bit more about that in the case studies that follow in a few minutes. There's examples here where the work is shaping action and policy, so a bit on the right-hand side around the Walk Nots work, which is around increasing opportunities around walking and wheeling opportunities and how we're coming together as a network on that agenda. And then more broadly in the cross-cutting box at the bottom, some areas where we're influencing further action, like the Building Blocks of Health programme that I just mentioned. So I know I'm rushing through and there's a lot of information here, but we're really keen that we've got the time for the cases. So I'm going to hand over to my colleagues, Jenny and Nina now, for a brief overview of the recent work on spatial planning and health.
So hello members, my name's Jenny Charles and I work alongside Nina Wilson, who's one of our planning policy practitioners. And really what I just want to just sum up in three kind of brief bullet points is the importance that spatial planning framework plays in the building blocks agenda, which is pivotal. So it's a systematic approach. And as you can see, we've done this over a long period of time, and this presents us an opportunity and at the same time a challenge to effectively implement this re-emergence of the spatial planning and health framework. So really my presence here with Nina is really a call for support from members to kind of help with this reinvigoration of the spatial planning and health. And it is fundamentally pivotal to the building blocks of health because it has all those elements that support it within its criteria. So its significance is the collective efforts and collaboration which is paramount for this initiative's success and sustainability. And essentially, it is about collaboration and partnership across our local planning authorities. So I've done that in probably less than 2 minutes. But if Nina wants to add anything, that would be welcomed as well.
Oh, hi everyone. No, I've got anything to add. Thanks, Jenny. So we're open for questions if anyone wants to ask anything.
We'll have questions at the end. There's discussion time, isn't it? So thanks, Nina.
Okay, thanks.
Thanks, Jenny. So I'm going to hand over now to Andrew, who I think has joined online to talk us through some work in Manton, the investment community work in Manton. Thanks, Andrea.
Good afternoon, and thank you for inviting me. It will be a challenge for anybody who knows me to stick to 2 minutes, so shut up when I'm done. This is a really fantastic example. My phone's ringing, apologies. This is a really fantastic example of integrated working in action at a really hyper-local neighbourhood level. We do this amazingly well in Bassett Law, but this is the latest edition, if you like. It sits together as a recipe under investing in communities, and we've taken that very targeted approach on Manton and threaded together various strands into a fantastic tapestry or a recipe into a fantastic cake, whatever metaphor you'd like to use. Critical ingredients in there, having the right partners on board. Sorry, I'm using a district council building and it keeps ringing. And, you know, our local place colleagues, our local district council, our public health colleagues, and most importantly, our VCSE colleagues have all come together to create this fantastic piece of work. It's really not rocket science. It is about getting down on the streets, knocking on doors, building up relationships and creating those ladders of engagement, using that building blocks model to embed activities that are going to achieve those health outcomes in the way we deliver this. There's a great film there that gives you a flavour if you want to watch that later. It's just a very short film, 3 minutes. And it will give you the flavour of how we work on the ground in Bassett Law. But we always achieve more than the sum of our parts. And what's remarkable even about this particular programme is the scale and pace at which we've seen change happen. So people really coming together around the concept of coming together in a community garden, collecting food, cooking together, eating together, getting to know their neighbours. And we've had people coming out of their houses for the first time in years, getting to know their neighbours, developing an interest in volunteering, growing and eating, and so many more outcomes still to go. I've got a few numbers here just to share with you, which have been remarkable because the participants have only been involved in this phase since September. And we've already seen these really dramatic results from a team getting out there, getting to know communities and then getting to know each other. So 35% of participants since September have reported an increase, or rather, there has been a 35% increase in physical activity of the participants. 31% have reported significantly improved connectivity with their neighbours and community members. 95% will recommend the project. 45% have increased fruit and veg consumption as a result of this. And 80% really want to carry on and get involved in volunteering and learning to take this forward. So in just under a 6-month period, that has been a remarkable pace of change. We've seen, there's a couple of examples there of young people coming together and wanting to set up a boxing club. The area of Manton, in case you don't know, right at the top, as you can see in that map there of our county, and it's an ex-coalfield area with really high levels of deprivation. It's a core 20 area that's firmly entrenched, and you can see in the data around the health inequalities that sadly are prevalent there. The key really has been continual conversations and listening to members and having a really agile approach to respond to what they want, but coming together every week to get to know each other better and explore what matters to you and what next. And we're going to be sharing a whole series of case studies working with the University of Nottingham and the University of Reading, plus active partners, to really document the impact, because it's been remarkable. I think I've had over my 2 minutes, and I'm happy to take questions or share more information if you'd like.
Great, thank you, Andrea. And there's a link there, isn't there, in the slides that you can go to?
Yes.
Really useful. Yeah. Thanks, Andrea. Okay, so next I'm going to invite you from Ashfield Volunteer Action to talk through a case study from Coxmore, which is all about showcasing community.
Yeah, good afternoon, everybody. I think the Community Resident Action Group, CRAG as we call it, might give you the wrong impression. I started at Ashfield Volunteer Action as the new chief exec about Christmas a year ago. And this is one of those communities, it's in the top level of deprivation, that has had money thrown at it, consultation, this, that and the other, and me being me. So let's have a meeting, what do you want? Right? And they didn't want this, and they didn't want that, and they didn't want the other. I said, that wasn't why I asked you. I said, what do you want? Right? And they went, well, I says, and what can you do? That's what started it. We then put 6 weeks in on the estate, paid for somebody from the estate to go around and do the consultation. I says, we're not going to get a different bus timetable. We're not going to be able to move the supermarket closer. Right? I told them, you know, all these things that have been on your list for years, put them to one side. Right? All right then, you know, she's a bit game, isn't she? She's telling us. Anyway, so we engaged, right? And what was born was the Coxmore Resident Action Group, led by the community. And I do have to say, hand on heart, my thanks really go to partners, because I can clearly remember the day when I sat there and said, we're going to build an event and I don't want you there. You know, I says, even I'm going incognito. I'm not going with my thing on or anything else. This is about residents. And you could sort of hear it in the room, the frisson, but he's like, all right then, Una, basically land on your face then. So we got a field which wasn't even mown, right, on a slant, on a triangle with nothing on it. Risk assessments, everything, right, working with the community. And there were only about 3 or 4 of them at the time that came forward and really did donkey work, like it happens everywhere, right? Love them to bits. Of course, they needed help with the booking of the field and the everything else and one thing or another. And those residents, along with other neighbours, we hadn't got lots of money to chuck at an event. So what did we do? We saved up our water bottles from work. They whipped off the bits that went around the outside, put a smiley sticker on, filled them up with water, and somebody sewed all the bean bags, right? And the kids were playing that sort of Skittles. There was a talented artist on Coxmore who drew just some really outline basic drawings. We took them back, we photocopied and we made crack colouring books. And the parents came with loads and loads of different pencils and things. This is on this day. And picnic blankets, and the kids sat and drew. We got support from 9 different businesses, including Ken Gregory's funeral directors, who allowed us to use as many of their marquees as we wanted. Right. We'd also got things like a local pet shop in Kirkby, where we said we want to run a scruff stock show. All right then, what treats do you want? What prizes do you want? But they came along and they judged it, and everybody had great fun. We had somebody say, we're going to bring a bouncy castle, right? And I said, right. I said, so what's the reduction? And they went, what? I said, this is coming out of community one. So not only did they reduce it, they brought a second one. They brought one of these bungee runway things, and they were there. There was so much happening. But just picking out of this, I was the person that spoke to the woman who'd lived there for 12 years and never spoke to anybody. And she was walking by the bottom with a dog. And I went, do you want to come in the dog show? She went, how much is it? I says, it isn't. I says, but your neighbours are up there. We started putting this thing together. So there were 3 volunteers from Ava and me and the CRAG volunteers putting it together, not expecting a soul that day. It was pretty overcast, I'll tell you. We stopped counting at 250 and it must have been 300. And people were actually saying, we've never had such a good day, we've never spoken to so many. So what do you do from there, right? Well, it talks about a fingerprint tree, and I thought, well, you probably don't know what one is. That is the Craig 17th. This is the original, you know, it's laminated. All these separate kids putting the finger on to create the tree for much more. That's that. So then what do you do, right? We worked with them. We created a Facebook page. At the end of that day, we'd got about 25 signed in straight away. We got people saying, what can we do? How can we be involved? The next thing was a Halloween party with a difference in brackets, because we don't do anything that looks like it says on the tin. So we'd heard that families don't connect at school gates anymore. Some people don't go to the family centres. Some people have mixed families where some children are older and younger. So we put this on, and at the same time we put tables for the parents, but we said, you can't dump them and leave them. You have to stay, right? Safeguarding, hey, yeah. Anyway, safeguarding played off because they all sat around the table and they got to know each other and formed a little group and formed a little thing of volunteers. So they all went away quite happy with a sack and also all the ingredients and the recipe and a pumpkin for pumpkin soup, right? Everybody's happy bunny. So what we're up to now then, I'll cut all the middle out about Christmas. On Monday, volunteers called at 163 houses. They have mapped the whole of Coxmoor and who's going to which about digital, NHS digital app, and they go into every single door. We put in a bid for 2.5k for their IT, and they've got the IT, and they're going to get trained up, and they're going to do it themselves. We don't have to fund that anymore on Coxmoor. Then on the other side, there's the thing about, just as a quick flavour, and I know I'm going over and I'm trying to get faster, but believe me, I think it's worth listening to. Right, so this is their words. Work together to make small changes which can make a big difference to the lives of our fellow residents. A group litter pick, and that's something that the volunteers have been doing, because one of the things was dog fouling, and even though they might not be out with the dog, they've made a big show of picking it up and it's got an awful lot better. Right, a bit of shopping. One of the things they said was, we're very willing to help the elderly on the estate, but we're scared to knock in case they call the police on us. So what are we doing? We're DBS checking them. We've created CRAG with Hivies and everything, and they've all got badges and one thing or another. We've trained them in safeguarding till this week, right? So they'll go and collect the medicine. They'll put the next door neighbour's bin out now. They're having a cuppa with a lonely resident. These are all the things we need in all the health strategies. They're offering lifts to appointments because the buses don't run, helping them fill forms in. So, and then if people want to come, and it says pick your team. Do you want to be part of the events team, environmental litter picking team? Do you want to be part of the digital support team or the neighbourhood connection team? And that's just the start. So then at the end of the month, we're having a great big spring fair. And obviously we've got some activities going on, but we're linking in with people like Men in Sheds who're going to let them do pyrography for the day for free. And these, right? Managed to raise some funds from elsewhere for growing food. So we as Ava raised it for, we've got £1,000 for these, which equates to 75. There's 12 different vegetable packets in there for them to grow their own veg. And the booklet is in multiple languages, which they love. And the best thing is we got them from the National Trust, so that £1,000 is going round again. Thank you. And it's all there.
Great, thanks, Ina. And I'm going to invite you.
Sorry,
I think it's hanging This is our last of the PVP updates. Thanks, Fiona.
I'll try and keep it brief as well, but really difficult, I appreciate. So I am the Health Development Officer at Gainsborough Council. And in 2022, Killistic was selected as one of the areas for a pilot project funded by NHS England. To look at reducing health inequalities in a sustainable way, place-based. So Killistic was selected through data and insight. And as a small group of partners originally sat around the table, I think we first meeting of 6 different organisations. And we started to think about how we could work a bit differently in this area. This area was used to having initiatives dropped in, out, and very little engagement from the community. That's surprise, surprise. So as a collective, we decided that actually we could work together to look at the community engagement. And rather than getting one individual from one organisation, that actually we'd all do a little bit. So I would do a bit, but other partners would also do a bit. But to do that, we needed a framework and something to follow that could enable consistency. So we used the building blocks of health to frame our community engagement. That tiny little box in the corner that you can't really read just gives you an idea of how we use the block and then how we use a question to get some information that would feed into that block. So we went out and engaged with residents, with stakeholders, and then fed that back into the partnership using those building blocks to help us to feed the work that we were doing. And that approach then started to, I guess, highlight the gaps and the areas in which were important to that local community. And then we started to look at action. I mentioned there were 6 partners that were sat around that table, and by 2023 that had grown to over 18 different organisations, with various colleagues working for those organisations that now wanted to be a part of this piece of work. And what we started to do, look at those themes that have come out of that engagement and started to work with residents to actually make some of that happen. So one of the things that a lot of the residents were really, really keen to have was something in the holidays for families and children, the breakfast club. One of the local organisations in the area, Eden's Nest Church, decided that actually they wanted to take that on. So we enabled them to deliver a breakfast club in that local community, which actually turned out not to be just a breakfast club because every child also went home with a packed lunch. They were getting 2 meals for that day. And they also had social engagement throughout the morning with each other, and they started to build their own activities. We also engaged partners in some of those sessions as well, a very light touch, but enabling them to engage in what were the children's centres, family hubs, and other services that might be appropriate to them. As you can see, there's a list of different outcomes and initiatives that have taken place since we started doing that piece of work. Many of them, where appropriate, are still running today, sustainable. We've enabled some of those groups and organisations to access external funding. And just as an example, the Breakfast Club grew into an after-school club, and this week they launched their first community cafe. So they continue to grow. And I think one of the real key things is there's a real renewed sense of community and trust within residents and partners, which hadn't been in that community for a while. And then I suppose just one final thing, just to mention, the budget for that was 33k back in 2022. We've still got about £1,000 of that budget left, and we've managed to achieve all of that. And that is really down to the partnership work and the collaboration and the enablement of that community to be able to do things for themselves and not to be done too. 2 minutes?
That's brilliant.
Thank you.
Thank you so much, Julia. So I know that we're going over time, but just thanks for everyone that's contributed, not just to coming in and speaking, but also lots of partners have contributed to the report. But I know that I'm hearing some real strong themes in there about listening to communities particularly, but just hopefully you've seen the breadth of work under the ambition. I'm going to be really brief on the next bit because I know we're running out of time, but just while we've been pulling all of this together, it has highlighted some challenges. One is just more about how we coordinate and the governance we have of this work. This ambition is so broad, it's delivered in lots of different places. So that's just a challenge for us when we're bringing this together and something for us to consider, I think, with our place-based partners. The short-term nature of funding for some community-based projects, I think, is a reality. And I think that highlights for us the importance of robust evaluation and learning from evaluation and having sustainability plans for some of these what feel like short-term projects. We'll just touch on climate change here as well, a challenge around the impact of climate change on air pollution. So they're the things that we've just collated as we've gone through. There'll be more, but these are the things that have just been highlighted as we've put these reports together. The next slide, please, Lizzie. So where we are in terms of outcomes, So on the left-hand side there, the outcomes from the Joint Health and Wellbeing Strategy. You'll see the indicator colours on the left-hand side either show that we're either green, which means compared to England, we're doing better in Nottinghamshire, amber, which means we're similar, or grey, which means it's not numerically compared. Some of those are a little bit dated, and I would just steer partners towards, on the right-hand side, some far more recent work that we've done around understanding needs and understanding inequalities through all of the needs assessment work that we've done over the last 12 months on this agenda. So we've got the food insecurity, fuel poverty, community-centred approaches, and the health and work, quite recent GSNAs that have been through the board that have got a lot more rich information. There's also on the Walk Not's website lots of information around physical activity and physical activity inequalities. So I'll steer you towards that for more information as well. And then the last slide, please, Lizzie. So this is just one slide where we're trying to capture opportunities and actions that we're planning over the next 12 months, and you'll see a lot of this is building on what we're already doing. So we've talked already about how we're developing the Social Planning for Health tool, the investment in communities. We've got another year of delivery, and we really want to learn from that. Got another round of the food redistribution grant, for example. But we're also highlighting here some wider opportunities to explore. So, for example, with the development and the establishment of MCO, what wider opportunities do we have to work over bigger areas on some of these building blocks? I'm not going to pick any of those out in detail because we're massive over time. So hopefully this gives you a bit of oversight of some of the activity that's taking place. But obviously this is intended also to kind of stimulate discussion around how we can all support and advocate for work under this ambition and to explore what more we can do together. Thank you.
Thank you so much, and thank you to everybody. It's amazing what you all are all doing in the communities. Comments or questions from anyone? Councillor Wilmot.
Well, I've just listened to an incredible story. Yeah. Absolutely incredible. And I can I say, Ashfield Voluntary Action, I'm glad that they're in our area because they are absolutely fantastic, and the work they do. Because they work in partnership with so many other organisations, community groups, individuals, and it's only that brings best out of us all. So we've got somehow to involve all these groups. And I know you can't invite them all in here, but we've got to know what they think about the whole situation of health and well-being. You know,
teaching them governance.
Yeah. And as I say, giving every child the best chance of maximising their potential. We're doing great guns in a lot of areas, but there is out there. I don't know how we do it. We've got to tackle some of these problem families. There are tackling problem families because they go up to be naughty children and this, that, and the other. And I'm seeing them all the time, and I don't know how we do it. We've got to get into these families and make sure that they get the opportunities that everybody gets, because they think they're being left out in many ways, and it's a great opportunity there. Keep our communities safe and healthy. Believe it or not, the Health and Wellbeing Board should have the police here, because they are prime importance of delivering a healthy healthy people. Because if they know exactly what's going on and we combat the issues that they see, then we've got great opportunities to all work together to stop these actions taking place. It's such a situation, because a lot of the issues that happen causes mental health in our youngsters, in our grown-up people, and the only way of tackling that is to find out behind the scenes of what's going wrong. And so that's why the police are important, and they should be a member of this organisation. Well, whether they'll come or not, I don't know, but I'm hoping they will, because we're all in it to improve the lives of everybody, aren't we? And I hope we can do that. And as I say, everyone can access the right support to improve their health. Again, early intervention is primarily one of the most important things in your life. Being able to find out what the problems are in your life so that you can alleviate the problem before it gets excessive, and then you start wanting all sorts of help and situation. And as I say, mental health, good food and nutrition, or homelessness. Now, I don't know if you read that programme on TV last night. There's a homelessness people set up a home it's a school, you know, and they're doing some horrible things. Those sort of issues need to be addressed, you know, as soon as it possibly can, because what I've heard is a monstrosity that's taking place there, and we're going to find out why it's happening. And again, police they know exactly what many of the people are like, and so forth, and we can address some of the situation as quickly as we possibly can. But as I say, the strategy itself, I think it's well set out, and you know, I'm hoping that we have to sort all the problems out. But as I say, better mental health, again, prevention is an ideal opportunity to start with. On that, the homelessness priority, as I say, it's getting worse, unfortunately.
Yeah, thank you.
We know there's more people becoming homeless. Many of them, and I've been talking to them and so forth. It's primarily their own fault, because they don't get involved in anything. They don't look at how to help themselves and so forth. But we've got a great opportunity to work together and try and stop some of these incidents happening. And as I say, your organisations, your individuals, your community groups, all should be working in partnership with us all to better things, so that better things happen in our lives. And I just hope that we continue with this strategy and bring, as I say, more partners into the situation, so that it will be a better thing. But when we've got groups like this, so young lady sitting at the side of me, it's you know, it comes into my heart to think about. We've got so many good people helping the community out there.
Thank you, John. You're a charmer when it comes to.
I'm not.
Colin, did you want to? Yes.
So I know you've got a long list. I think Councillor Wilmot has raised there is that actually there are many people in our population that have a range of challenges. And I think we've got to be really careful around language, around some of this, if we may, because I think when we think about the causes of the causes, there are a range of things that have happened around these individuals and these families and the communities that put them in the position that they're in. And there's something for me around what can we as a board do as part of some of the fantastic work, and there's a plethora of work here that's been advertised to support those families to have different outcomes, because there's some work here that is intergenerational, and how can we break those cycles of poverty and crime and disadvantage to make everybody in Nottinghamshire thrive. So I suppose there was just something for me around just picking up on some of your points, Councillor Wilmot, around I think we need to take a broader lens around some of this and really think around what can we do differently, so that a child that may be in a really complex family at the moment has a different outcome tomorrow than what they would have had today. And I think some of the great work that we've seen here, and there's a real range, isn't there, in this particular priority area, really thinks around how we can work differently around that. And I think there's some excellent examples here, and I'm just really keen to think around the so what for the board. So and feel free to come back after all of the questions, but if you were going to ask for something from us as a range of strategic partners here, what do you need to make us move this agenda further, faster, stronger? Because I think that was the thing that was just a little bit missing for me, is what's the ask, and what can we do to wrap around this to accelerate the progress?
Thank you. Councillor Clydeswell. Colin, do you want to come in? No? Councillor Wheeler.
Yeah, I think it's some absolutely phenomenally good work here, brilliant work. Obviously, won't forever about Gelly, but yeah, it's a phenomenal amount of work here, and I think the key really around community cohesion is bringing a lot of those partners together. There's a lot of things on here that's not been discussed. So a lot of the voluntary sector organisations are not in that report are actually crucial to actually making these things work. So, for example, in an organisation called Positively Empowered Kids, who work with a lot of the families who are quite challenging. Myself, if I take the council hat off, I put the youth worker hat on. We did a lot of work with the youth service in and around that community, working with a lot of those challenging families. And I have to say, it's been one of the best initiatives we've ever had in that community. We set up, working with a lot of times, we set up a Facebook page called Friends of Killison, which is growing. It's got like 809 people on there as well. I set up a community litter pick group, which has got 124 people in there. And from that, obviously, you start to engage with a lot of those families who have had intergenerational deprivation. And I'm pleased to say that some of those families that have those issues do actually come along to the litter picks. They come along to get involved, take pride in the community. They've been involved with the fun days that we've held as well. And they've also actually, from an environmental perspective, got involved with some of the backwalks. We've done backwalks and things like that. We've done walks in and around nature reserve, the hot works. So we look at some of the issues around health related to the environment and the communities that a lot of people live in. So it's been an absolutely brilliant success story, I think. So,
thank you very much. Dawn, did you want to come back in?
Yes, if I may, I just wanted to add something in this space. I'm Dawn Jenkin, consultant in public health at Nottinghamshire County Council. I'll provide some of the leadership around the building blocks of health.
Sorry, I can't hear anything you're saying.
Oh, I'm sorry. I'll speak up. It's unusual that I'm that quiet. I just wanted to build on some of the things that we've been hearing around the role of the voluntary sector and community groups and communities themselves. I think in terms of the approaches that you've seen presented here today across Nottinghamshire, which are fantastic progress and achievements in a very short space of time in some cases, really demonstrates the value and the assets of our communities and the strengths that are coming out of that when we provide that little bit of coordination, support and engagement from places like Ashfield Voluntary Action. The strengths and the richness and the building of social assets and connection are quite unparalleled. And if we think about trying to achieve that through any other route, if we thought about trying to achieve that through placement of somebody into that community from the county council, for example, or we try to achieve that through structuring a commission programme, I'm not sure that we would ever achieve the level of richness and the level of asset building, cohesion and development that we see coming from communities themselves. And for me, in sort of a public health perspective, that really demonstrates the power and the assets of communities themselves. So it's really kind of a call in what I'm seeing from this work to value what communities have to offer and to reciprocate that valued offer by support in whatever forms that we are able to offer into that space. So for this board, I think some of the questions that we need to follow up in this space are, what can the board do to help to hold that sustainable space? Because it does take coordination, organising and a degree of funding. And we can see that a little bit of money goes a very long way in that space. And thankful to our colleagues in the voluntary sector and are making every pound count. But what is our role to make that sustainable? Or should I say your role as the board? And secondly, how do we increase that opportunity, like Councillor said, of hearing the voice of communities and place-based partnerships and voluntary sector in this board? So how do we increase that opportunity to have a dialogue, to hear and to let what we hear happening in communities shape what we can do as a board? Those would be the questions I'd be asking from my perspective as one partner amongst a wide range of partners who are needed to help deliver this space. Thank you.
Okay, thank you. Councillor Sheila.
Thank you. I would just like to congratulate everybody that's delivered that project today, and And in the spirit of balance, I'm going to big up the Bassett law. I wasn't going to, but everybody else did. I want to draw out of this the actual how you've taken your communities, you've spoken to your communities, you've looked at what they want and what they need, and they have been your drivers. Yes. And I think that is the reason why it has been so successful, and that you've managed to move things on so quickly, really, because it's easier to bring people with you than to push them towards their healthier communities. In terms of, Councillor Wilmot, you talked about these people should be sat around the table on a regular basis. However, I see that as my role. I see my role coming from our district councils to bring this forward and to bring the results and to talk about the results. I absolutely think it's brilliant for you to come along. However, you're doing a better job out there, really, truthfully. So I think it kind of underscores that the need that we spoke about earlier, about us as councillors understanding why we're sat around this table, what our roles and responsibilities are in sitting around this table. And just finally, thank you, and well done to you all.
Thank you.
Is there any chance, Chair, I could just make one comment?
Yeah.
If I could make a plea, right? not known for making pleas at all, but it would be the recognition of the restraint that's required in the voluntary sector, not to dive in and go, do you want one of these? Right? And that level of build, that level of confidence building, so people trust you and you stand back and you're not badged up and you don't go around saying, oh, we did the... That takes a lot of time and commitment, and it also is a learning curve for the sector itself. Okay, so that's all I'm saying. There might not be shining stars, right? We have 27, organisations here with a stand, and quite frankly, for me, that don't float the boat. You have your stand, you have your leaflet. I want to see the community come and talk about what they can do. So restraint needs support. That's all I'd say.
Okay, thank you. Colin, did you want to come in?
I'm just going to make a point about a number of times today we've talked about there isn't any money. I would unusually say there's loads of money. We're just spending it in the wrong way. So it can't be right that in 2025 the children of West Bridgford are 9 times less likely to become a looked after child than the children in some of the communities we've just been talking about. That can't be right. The primary driver for that is child poverty. And the things that affect that are things like parents being lost into drugs, alcohol, domestic violence, and mental health. And that looked after child is 30% more likely to be that homeless person in a tent outside that school in Beeston, and Councillor Wilmot. That just can't be right. We need to break a cycle. We need to get the money out of that deep end of paying £149,000 a year per child who is looked after into supporting children to remain with their communities and their families. If it can't be their birth family, then their kinship family and uncles, grandparents. It can't be then foster placements. We're spending too much money at the wrong end, too late. Government has just given Nottinghamshire County Council £3.2 million to drive early help and prevention. I think this board should hold me and my department to account as to how we spend that money and to ensure that that money is spent in the most critical and effective way around early start and principles of what we're saying is priority. But thank you to the community.
No, thank you.
It's time for me to just come in a couple of points.
I've got Councillor Henry, and then do you want to come back? Is that all right?
Yeah, thank you very much. It's been amazing listening to. Oh, it's amazing. It's nice to see that. I mean, Councillor Milmot, I know you mentioned something about homelessness. Sorry, and I was looking at your document here on the homelessness bits, and I thought, currently there's no senior strategic oversight group for housing at the county level. So, and it's been like this for a while, I understand. So, what effects is it having on tackling homelessness across the county? And why has there been no progress at all to determine where this oversight sits? I don't know whether it's food chair or social care, or I don't know where that goes, and what are we not having any type of oversight of that? Is it you, babe?
So I don't think it's just me, I think it's all of us.
All of us, It's at the county council, I'm thinking
But I think there is something around how are we going to establish ourselves as a health and wellbeing board that does stuff. And for me, we've got two key actions that have come out of just those two conversations there. One, in terms of, are we as a health and wellbeing board happy to endorse that we feel that there is a need for a strategic housing group? And I'm not necessarily have to articulate the how it's done, but I think there's something around we can define the what, and saying actually, do we think do we feel that there's a gap here, and we would like to see progress around making that happen, would be one question. And the second one is, Colin, I think it would be lovely to have a conversation around how we might want to support you in making sure that, and from a public health point of view, and public health and public health and communities broader, in terms of how we maximising every bit of the additional funding that you've got, but also how we're doing that across all of our agencies around that prevention and building blocks agenda. So I think it would be really helpful to have some of those conversations. And I think this for me is where we think around how do we turn the tune of the board to enable those conversations to happen. So we might want to think around, one, whether we start having actions to discard and follow up, so we can actually follow up. And then if those actually, you think 6 months' time we still don't have a strategic housing group, then we can ask the question, why not? But there's also something for me around, and it come onto the work plan objectives around how are we collectively agreeing what do we think would be a really helpful agenda for a workshop session within the board, so that we are all owning it a little bit more rather than it's just things that we think should go on. So I would be keen to support that approach, and I think the presentation today has been really helpful in stimulating our thinking in terms of how we move ourselves into that space. So thank you.
Yeah, just first of all, thank you so much. It's incredibly inspiring, really powerful. And actually, I think there's an opportunity there to bring some of those together and showcase them in other places, because actually it might inspire action elsewhere as well. So let's sort of make a comment to that. And I wonder also about, I think Dawn, you make some points about this in a sense, but I was saying what works with these types of interventions, understanding those and understanding maybe they're quite contextually based. They seem like they're all going to be very different. It's not like you can say like, Una, your project, to put it somewhere else, but maybe there's some lessons there that you've learned. Are we capturing the lessons? And actually for the volunteers to say, we hold back, we don't jump in, I've learned these things as well. So capturing some of that learning that you've all had doing your own different projects, taking that to helping other people through that. So it feels like you've got really interesting community practice around building blocks of health. Maybe there's something related to that around these sorts of interventions and helping develop community leaders so they understand what works in those things. So just slightly the language of, oh, these are really cheap interventions. They're not, because of all of the long-term embedded work of Una and the team and Andrew and others as well. So just make sure we're not going, look, 30,000 we can achieve all of this, because actually behind all of that, I think there's a lot of other social infrastructure that makes those things happen. So this is the stuff that can turn it, but you also need this other stuff that happened before. So I'm always conscious when sometimes volunteers have gone, it's really cheap, and I don't think it is that. I don't think that is what people are saying, but there is a way that could be interpreted around that as well. So let's think about actually what are the enablers that make any of these things happen. What I also really just final point I think around from the evaluation funding point of view, what's nice in the way you're presenting it is this is about an understanding communities, not in a way that sometimes you have a whole load of targets that are really measurable. And I think what you were saying, you could easily have done a project and then had lots of stuff that looked brilliant on the evaluation form, but not really understand the community needs. So I think something in this about this is a grant to go get on work in this place and work it out with people is really powerful, and then learn later. I think is a really important thing, rather than sometimes our funding and we scrutinise things in such a way that drives measurable outputs, but not deep outcomes. And this is about social relations at the end of the day, it seems to me.
No, thank you. I've got Councillor Tideswell and then we'll go to Carol because I'm conscious of the time. So Councillor Tideswell.
The real enablers are the ones who live in the community. It has to be community-led engagement. This is what a lot of people miss out on. No matter how much money you throw at the problem, you throw as much as you like. Unless you've actually got the community on your side, you ain't going to work. When I took over council in Chilwell, it's not exactly millionaires right where I come from. Yeah. But nobody was on talking to anybody. All I did, and my fellow councillor, we walked around, we actually said hello to people. Eventually, people start saying hello to us as well. Simple as that. No, scientific formula to it, and it does work. Same as I know, evidently, they tried on community well, it's working. And that's what we need to do. Make sure we are enabling.
No, thank you. Carol, do you want to sum up, answer anything?
Yeah, I just want to really echo that about recognising people's assets, because I think that when we think about some of the community sectors approaches that we've just heard, that's one of the foundation principles, I think, of recognising people in our communities as assets. We've touched on mental health a bit, I think, in some of the responses, and I just wanted to say that while we might not explicitly show it when we're putting things in building boxes, I think mental health is intrinsic in those community-centred approaches when we think about community connection and all those opportunities. I think it runs throughout those community-centred approaches. And to your point, Viv, around what we're asking of the board, and I think we've heard a lot today about another principle about really listening. And I think there's an ask of what are we doing with what we're hearing on a more strategic level, and how is that informing wider approaches, not just what's happening in those specific communities. So I think that's something we can challenge ourselves on. Daniel, your point about evaluation, we're learning as we go with some of this. So we're trying to pull together the different approaches across the different three PBPs and bring together monitoring and how we're telling the stories. We've got one more year of that and we really want to learn from that. So if there's any offer of help, I suppose is where I'm going with that. And then lastly, I just wanted to thank partners who, it's been a real partnership approach to pulling this together, because it all relies on the partners. So I just wanted to thank everybody.
Yeah. I just want to say, in view of my Councillor Wilmot, I've known Unikey for over 30 years, but for these things to be driven, you do need the right sort of leader, whether they step back or not. Because without a driving force, like all the projects that are successful, you need a key person that is showing the leadership skills to get the community rallied round, even if they're a step back approach, but they've got the knowledge on how to talk to people and how to get people to do it themselves. They are a special kind of person. Like we've said, you can't just put a worker into a sinker state and expect it to turn around in 6 months, because it's a trust and everything. As you said before, you need somebody that knows the area, that is trusted, that is of the area, I think, to make things work. But strangers don't often work in some parts of our communities.
No, thank you ever so much. I'm conscious of the time. So is everyone happy with the recommendations? I'm sorry, we really need to move on because we've got
10 seconds, that's all I need. We've talked about homelessness really a lot, but what the scandal is at the moment is how many empty homes there are in Nottinghamshire that have been left, which have been left to derelict, become derelict. And, you know, it's a scandal that we've got all these homes available that are empty.
That's something we can talk about at another time, but let's move on. Is everyone happy with the recommendations? Can I have a show of hands for the recommendations? Thank you ever so much, and it's been brilliant, so thank you ever so much to everybody, and to people on screen as well, so thank you. Right then, next on the agenda is the report on the Better Care Fund Q3 National Return. The report provides an overview of performance outlined in Q3 reporting template that was submitted to NHS England on the 14th of February, and they asks the board to ratify the template. And the report also seeks support from the Health and Wellbeing Board for the proposal to review the approach to BCF reporting and decision making in response to feedback from one of the previous meetings that we had. So before I hand over to Anna Oliver, can I have someone formally second on the recommendations on page 65, please? Yeah, thank you. Right then, Anna.
Thank you. That's going to sound really boring. So, just to update really, our Q3 return for our BCF plan went to NHS England on the 14th of February. As always, the dates didn't quite align nicely with obviously our Health and Wellbeing Board date, so we're now requesting that the submission is ratified at board today. So our Q3 return contains our monitoring data against our 24-25 plan and also against our target KPIs, as it does every quarter that come. As a quick reminder, our KPIs are our national performance metrics, and they include avoidable hospital admissions, falls, discharge to usual place of residence after a hospital stay, and residential admissions to long-term care. It also includes the return on our BCF, not on our discharge grant, which is the additional monies we have to support people to leave hospital, and also our admission avoidance. So as in our previous quarters, we are meeting our targets around avoidable admissions, falls and residential admissions, but we're still showing a slightly off target for people returning home to their usual place of residence. But we do know that is because of where our reporting comes from. It comes from a national data set that has slightly different coding in than we have locally. So locally, we're much closer to being on target, if not actually exceeding. Councillor Eddy just mentioned at our previous board meeting, we did talk about wanting to add value to our reporting, so having a greater focus on the impact of programmes that are funded by our BCF. So we are looking at that approach and how it will be considered as part of the review for the BCF, so we're working on that.
Thank you. Any questions, comments, Councillor Wheeler?
Yeah, sorry, just say for transparency issues at the start, I am the cabinet member for Associate County Council as well, so I was just getting my time in that portfolio. So I will just say that for transparency. I think for me, it's just to say, first of all, thank you to Borough Council partners, because there's been a lot of work done in terms of the Better Care Fund, trying to adapt ourselves the way the funding is spent, because unfortunately, despite a lot of change, they haven't yet, although through the work that I bring to government in my hat, and as a lot of councils have as well, they are now proposing to a review on the Better Care Formula and how especially the DFG grants are allocated. And we still have the issue where in some parts of the county we have districts who spend all their allocation and are putting in their own money. Rush Kippers on the city on us putting over £200,000 in if the budget goes through tomorrow night to meet the need, and we have some councils who don't have the need and so aren't spending the money, which I understand should be wasted. So we're trying to look at how we can also spread that better. So I do thank the council coming together and agreeing we should look at a pilot programme for that, which is really key, and I hope we can keep that going forward, because again, it's a postcode lottery of where you are. And as we've already talked about earlier, and I talked about before, the cost of keeping people in other places not back their own home is huge, not just financially, but also the mental cost toll that can take people not being in their own home. So we do need to do that for the best we can. In terms of, say, the team there, Anna does a great lot of work, so there's Martin in terms of trying to push it forward. So yeah, that's just my theory. So I want to keep working together on that one, so we can actually get the money very allocated. And in any lobby you can do to your MPs through councils to have them to participate in the review by government, please do so. And I hope that the board will as well take that, also part of that on stage as well, to also make sure we make our voice known as well, that we do think that needs to be looked at. That's my recommendation anyway, just to make sure that we meet the needs that we have our community, based on, like I say, the old formula, which isn't going to work.
Very happy to. Councillor Crosby.
Thank you. As a local authority, we'd like to better understand the spend within fund. We're having regular conversations with the Sherwood Forest Hospitals Trust around hospital discharge. So we'd like to better understand it in a local context when we are supporting around housing, for example. We're happy for that to come back to us in the at the same time.
Is that all right to go back?
That's fine, thank you.
Any more comments, Katie? Anything else you want to add?
No, just with support. Very happy to bring more detail. Yeah.
Perfect. Councillor Tideswell.
We are fortunate in Broxton. We have a very proactive health and wellbeing officer. I'll say quite so, Alex McGee, and he does proactively go round and make sure that money is being spent by the community for the community. And I think that is what we must insist on when we are looking at improving local lives. Say we do have a very proactive officer. It is nice to see him going around engaging with the community as well. It always works. Brilliant.
Thank you. Any more comments or questions?
Just one. Just a very quick one, Chair. Congratulate the team on the work that's been done, because it seems that everything's been so, been put through, except that you've just got the problem of the people being discharged from hospital to their normal residence. It just seemed to be a problem still in that. But what I'm more thoughts I've got about is the care that they get when they get home. There's a lot of companies out there, private companies, and I just hope that some of the things I hear about, being investigated at the present time, is to make sure that everything's being done correctly, because there's nothing worse than being looked after well in the hospital and you go home and the company comes in and doesn't do the job right. But I'm just saying, it's just make sure, we've just got to make sure that everybody gets looked after when they do leave hospital.
Okay. Did you want to come back?
I think just meant the point that the discharge rate has halved. Great work that the county council has done with the NHS colleagues, so we are making great progress on that, and it just shows partnership working does work. And also, you're one of the many council fellows during my budget speech where I talked about it. I don't blame you if I would have. Like I say, it's great work there. But like I say, in terms of care at home, we do obviously offer that great care, which the council teams do, and there are other providers as well. But as I say, it is about that partnership working, and like I say, you could thanks to our colleagues in NHS for working closely with us on that and the success we've had.
Okay, thank you. Any other comments or questions? Okay.
Can I just question one in terms of recommendation 2, which is about supporting a proposal to review the approach to BCF reporting? Because I know that you have an annual cycle, don't you, in terms of when you are putting forward the BCF plan. And obviously BCF is a statutory responsibility of the Health and Wellbeing Board, so we need to make sure that we're fulfilling that statutory responsibility. But I think there is something around the fact that we're just ratifying things that have already gone in this situation. So how, again, come back to our earlier conversation around how we're utilising the most effective use of this time, it'd be really helpful to know whether we're going to make those changes so that the board can genuinely support the strategic direction of the BCF in future years, and how we're going to manage just the ratifying approach, I suppose. So I'd just be keen to understand, I suppose, in terms of time-scales, and if you've got any additional thoughts around that.
Want to come in first, Anna?
I was looking at Lizzie because we had a conversation the other day. Yeah, if you wanted to.
I'm coming on that. We've just we've started the conversation, I guess, looking at what the reporting could look like going forward. Obviously conscious that we don't want to duplicate, I guess, discussions that take place elsewhere, recognising that the principle, I guess, of where things are for information, I think we could perhaps share that differently. We obviously need to understand from legal colleagues kind of what needs to be shared with board because of the statutory responsibility around the better care fund in terms of actually coming to formal meetings. But that we're having a look at proposals at the moment, aren't we? I know in terms of what that could look like and taking into account that sort of strategic oversight of the annual plan as well. And the intention is to bring that through the steering group for an initial kind of look and then hopefully bring that back to.
Yeah, that's great. And I think I just want to reinforce that link with the work being done that is funded through this work, and particularly the hospital discharge and preventing people, as many people needing to go to hospital, with a lot of the things that we've discussed today about prevention, about neighbourhood health, etc. So making sure that this board feels that they can make those links too is really important.
No, thank you. Thank you for that. I'll move to a vote and a show of hands for the recommendations outlined in the report. Is everyone happy? Fabulous. Thank you ever so much. So finally, final item on the agenda is the work programme set out on pages 81 and 82. Board members are asked to note the work programmes and make any further suggested devices for inclusion for consideration by the Chair and Vice Chair in consultation with the relevant officers. Can I formally move the recommendations on page 86? Can I have a second, please? Thank you, Sinead. Right then, are there any comments or questions on the work programme?
Just to say, congratulate everybody today on the best Health and Wellbeing Board meeting I've ever been to. And the discussion has been absolutely fantastic. And if everything is implemented, that's been talked about or looked into, we're on to a winner.
No, thank you. Thank you. Councillor?
The bit we were talking about around the strategy for the housing.
Yes.
Can that be seen somewhere, put somewhere? I'm not sure if it can be part of the program or not. Because I think if we look at it's an issue that is too long that we haven't had a strategic oversight. I don't know whether or not that can be there.
Sorry, Chair.
Yeah.
So do you mean in terms of having an action?
Yeah.
Yeah, so I think let's just think around how we can have an action to that. And I suppose there's something then around once that's up and established, we might want to consider whether the board gets into that detail a little bit more as well. So I think. Can I ask another question, Chair? So when we're looking at the next meeting, which we've got on the 25th of June, we've got the DPH annual report on women's health. Now, I'd be really keen to think around, I've seen some initial results today, and there's a lot in it, Chelsea, and I think it's going to have quite a broad-ranging reach to a range of partners. So if partners were happy, I'd be really keen to have a little bit more time potentially in a workshop situation to be able to get into the detail around what we can do differently around that. So that was really one of my proposals, and I was just seeing if partners were happy that we could consider putting that on the work plan. Because that's specifically looking at why are we seeing the reduction in healthy life expectancy in our women in Nottinghamshire at a rate that is at a faster rate than the national average. And there's some really interesting tools that are coming out of that I think partners would like to get into the detail of it.
I think that sounds interesting, definitely.
Just one thing on that. If the meeting is going to be longer, I think we should look at the timing of when we start the meeting, because I don't want to be here at 5 o'clock. Because it takes a good hour and a half to get home.
You'll be at another place probably. It's June.
Totally take that on board. Councillor Sheila.
Just making the point that we've already spoken about the fact that there are elections in May, and that lots of different people may be sat around this table by the 20th of June. And I think there needs to be something to prepare those people prior to that first meeting, and maybe you need to schedule in something like, I don't know, a Teams meeting to share what the responsibilities are and to give some kind of ideas. It might be even just the building blocks for health for some might be new. So
no, thank you ever so much. I definitely think that should be taken on board, and I'll pass that over to you because I won't be here. So can we vote on the work programme? Everyone happy with the recommendations?
And the additions.
Pardon?
And the additions.
And the additions. Thank you ever so much. And then finally, I just want to say thank you to everybody. It is my last meeting. because I'm not standing again. So thank you ever so much, especially to James and Viv, but especially to Lizzie, who is fabulous. So thank you to everybody, and I will work with you soon.
And I think lots of us would like to say how well you chaired the Health and Wellbeing Board, and you have been a breath of fresh air and really good and tolerant chair.
It's not a usual style.
Taken into yeah, it's not a usual style. Taken into consideration people's needs. Thank you.
No, thank you, Alison.